Welcome to those colleagues who are beginning to join us online as part of the virtual IAS, and welcome to those people who have decided to join us today in person. And I am very thrilled by the turnout to this particular IAS lecture. It's fantastic. My name is Marcia Meskimen, and I am the Director of the Institute of Advanced Studies. And it is my great pleasure to welcome today Heather Adair-Rohani, who is an IAS visiting fellow from the World Health Organization. We are welcoming Heather under two umbrellas. We have two auspices for this welcome. The first is the IAS. We are welcoming Heather as an IAS visiting fellow associated with this year's annual theme, which is Breathe. Breathe, as many of you will know who have been watching this theme unfold for the course of this year, is both a wonderfully enigmatic and yet wholly quotidian and universal theme. We all breathe, the world breathes around us, we breathe within it and through it. It enables us to bring together a range of scholars. There are some 24 scholars coming over the course of this year who are joining us around that theme, and they come from all different sorts of disciplines and all countries around the world. So we are really thrilled to be welcoming Heather as part of the activities that are operating around the Breathe theme for this week. And also we welcome another 4 fellows over the course of this week, and a range of activities. There are activities tomorrow and activities throughout the course of Thursday and early Friday. And we do hope that if you are interested in some of the issues that are being raised tonight and by this theme, that we will see you again over the course of the week for these various other activities. And we will have another chance to talk about some of the issues that Heather raises tonight. The other way in which we are welcoming Heather, though, is through STEER, because this particular talk is a joint initiative between the IAS and STEER. And for those of you who need the acronym spelling out, that is our Center for Sustainable Transitions, Energy, Environment, Resilience. Now, I will shortly hand over to my colleague on the left, John Harrison, who will say a few words and also introduce Heather more specifically. But what I would like to say is that this kind of partnership, this kind of collaboration between STEER and the IAS around something as significant as the Breathe theme, working across the world with international fellows and also with a real range of interdisciplinary research collaborations that are focused on this question around Breathe and the kinds of politics that this raises, the kinds of health issues that this raises, the questions around climate, the questions around activist activities, as well as around art, design, literature, and the way in which we inhabit and imagine our world are things that are actually quintessentially what the IAS is all about. And so this talk is really exciting to us because it sort of kicks off this week of another really exciting period of time looking at Breathe. And with that, I want to hand over to my colleague who's going to talk about the STEER side.
Thanks, Marcia. Good afternoon, everyone. I'm stepping in for Ed Brown this evening. My name's John Harrison. I'm Research Director in Geography and Environment, which means as well as having Marcia as a wonderful colleague, my connection here is to the STEER Research Centre, which is based out of Geography and Environment. Now, it's my absolute pleasure to introduce Heather Adair-Rohani. Heather leads the work on energy and health at the World Health Organization headquarters in Geneva, Switzerland. Now, among many other accomplishments, I want to pick out 2 to focus on by way of introduction. So firstly, Heather co-led the coordination and development of the WHO guidelines for indoor air quality, household fuel combustion, and is currently overseeing work to support countries in the implementation of these guidelines to the Clean Household Energy Solutions Toolkit. For us in Loughborough, particularly Geography and Environment, this has clear parallels with the work being conducted as part of the STEER Research Centre. It's great to see so many colleagues here tonight from STEER. And for those who are not familiar, or maybe not as familiar as all of us, as many of us, around what STEER is. STEER was launched at COP26 in Glasgow. It is the new £75 million research centre, centred largely but not exclusively on 2 programmes, which is the £35 million Climate Compatible Growth Programme and the £39 million Modern Energy Cooking Services Research Programme. Now, MEX in particular has energy and health at its core, specifically the transition from biomass to clean cooking and clear connections to Heather's work. The second is that Heather actively participates and represents the WHO at various global initiatives focused on health, air pollution, and energy. One of these initiatives really stood out to me, which is the Global Strategy for Women, Children, and Adolescent Health. So what Heather and people in this room are doing is about all of us and our futures. Every child, every woman, these things really do matter. Now, I'm going to be slightly naughty and dangerously corporate for a second. But I present as a challenge to look for colleagues in the room and online that we have a new university strategy, which has as its title, Creating Better Futures Together. What Heather is doing and going to talk about tonight is exactly that. It is about creating better futures by working together. It's why I'm so pleased that this is being hosted by the IAS and not a single school, department or centre in the university. It's not about one pocket of activity on our campus. It's great to see people from different parts of the university joining us here this evening. Also, Heather's work and talk do not only cover one key theme within the strategy, but all three of the main themes that Loughborough University has identified. So climate change and net zero, sport, health and well-being, and vibrant and inclusive communities. But more than that, and the reason for drawing attention to the two examples I did, it speaks to the values and themes that are front and centre of what we are all signed up to at Loughborough University. Ambitious research and innovation, built on meaningful partnerships, internationally engaged, but grounded in values and an ethos that emphasises our responsibilities and to be authentic in all that we do, no more so than our commitment to promote diversity, equity and inclusivity. To this end, I'm absolutely delighted that Heather has accepted this invitation to join us as a fellow of the IAS. Hopefully this is the start of a long-term collaboration with friends and colleagues in Steer and Breathe and across the university more generally. Now, nobody's come here to listen to me, so without further ado, I'm going to hand over to Heather for tonight's lecture, which is on leveraging the health argument as a driver for evidence-based multisectoral action on clean cooking in low and middle income countries. Floor is yours.
All right, thank you so much. So yes, thank you for that really nice introduction. It makes me a little blush a little bit, but yes, it was. I'm very delighted to be here. And yes, I will really. A lot of my work is translating much of the work you do as researchers, really help policymakers actually make change on the ground. And household air pollution and household energy use is really hits very close to my heart because it's really a way to protect exactly the most vulnerable people that really have nothing, and really set us on a path forward for the global community. Because we really all work together, and we need to work together. And we, as in high income countries and in this development world, can really support billions of people around the world and improve their lives. So my overview. First of all, I must say I tend to talk fast, and if I start talking fast, please raise your hand. And that's just, I get very excited about talking about this subject. So it's no worries if you happen to say like, whoa, slow down. But luckily I'm with a bunch of English speakers, which is not necessarily the crowd I typically have. So I'll talk briefly about what is household air pollution versus indoor air pollution, because this is something with a little more specificity. I'll highlight somewhat of the barriers to adopting clean household energy. And what is it the health sector can actually do about household energy? I mean, why is WHO care, and what are we doing about it? And what is it that we're using in terms of the health argument? Now, I could actually talk for a very long time, because this is actually, each one of these could really be unpacked extensively. So I'll do my best to not do too much of a surface, but not too detailed either. And I will tomorrow break open a little more about one of the Clean Household Energy Solutions Toolkit in the panel discussion. So first of all, what is household air pollution? For many around the world, we can easily go and flip a switch, push a button to cook, to make some tea, to heat our house, to turn the light on. But for many, many, many people around the world, this is not the case. They literally have to make a decision between the risk to their health or making a hot meal, right? Because what they're doing, they lack the access to something that's so simple as a clean stove, a clean electric light, or a clean heating system. So they basically have to make that choice. So household air pollution itself I'll go into some of the scientific definition. It's basically household air pollution is the air pollution that's released from the incomplete combustions of polluting fuels and technologies in the home. It's caused when the polluting fuels themselves, they're not necessarily polluting. It's the technology themselves that makes them polluting. So when we're talking about polluting fuels in general, we're typically talking about wood, charcoal, dung, coal, crop waste, and residues. These are often the fuels that are freely available in the environments in low and middle income countries. So it doesn't require, the affordability is there. It just requires time. And, this is what the fuels people have been using for really since the start of humanity. So why is it polluting? And that's what one of the challenges is in terms of communicating this. So again, the household air pollution, we work with MECs and they're very focused on cooking, but as WHO, we have to be concerned about the entire home environment. So we're also looking at the heating and lighting aspects, because say you have a clean cooking stove, but then you're heating your home with an open fire, you basically lost all that benefit for health, because you're basically still polluting the environment with the heating stove. So we really try to do this all-inclusive approach. And the reason we don't call it indoor air pollution specifically, change it to household air pollution as a subset of indoor air pollution, is because it's not just in the home. It leaks out the chimneys and then circulates back in homes. In some places in low and middle income countries, you can actually have a series of households all right next to each other using clean fuels for cooking, but then you have the one household in the middle that's still using polluting sources. They're pumping that stuff outside into the environment and it circulates back inside because of open windows and what have you. So so it's really important to consider the full household environment. And in addition, in many low and middle income countries, people cook outdoors. So because of the heat, just because of the smoke, et cetera, it's easy. It doesn't mess up their home. They don't have the space. So again, it's this more around the environment. So really household air pollution contributes to community pollution and outdoor air pollution. And some people often overlook that. So this is the reason we speak specifically to the indoor air, household air pollution rather than indoor air pollution more generally. So what is household air pollution? Oh, it is a nasty mix of stuff, okay? You've got one of the biggest ones we look at, and from the epidemiological side, is particulate matter, fine particulate matter and more specifically. But you've got everything from carbon monoxide, NOx is in there, methane, volatile organic carbons, carbon dioxide, et cetera. So it comes from basically in different fuels provide different sorts of pollutants. So there's not one set of pollutants, but in general, it's a nasty mix of things. And we, in terms of the health sector, are very concerned, for example, with the particulate matter. And why? And that's because fine particulate matter, not the coarse fraction, but the fine one can actually, once you inhale it, keeps down into your, crosses the lung barrier and can impact the body systemically. And so this small particles, smaller than, like 1/10 of a piece of hair, goes into your lungs and really can lead to all sorts of diseases throughout the body. So we really focus on this fine particulate matter in terms of studying, and that's the emissions that we typically reduce, and we focus on in terms of the health aspects. In addition, the fine particulate matter is also one of the most researched epidemiology in terms of air pollution exposures. And so this is not just the household, but also the ambient air pollution. And in many cases, the ambient or outdoor air pollution often consists of the household air pollution. So as you can see from the diagram here on of the head, you actually can see the coarse particulate matter, which is 10 micrograms per meter cubed, actually kind of gets stopped at the lungs, actually, or the throat blocks it, but it's only that fine that I can actually get very deep down and cross over. So this is why we're very focused on this. Now, how big's the problem? It's huge. We're talking very big. We have about 1/3 of the world's population is still relying, this is just mainly on polluting fuels and technology for cooking. I estimate about 2.4 billion was last year's estimates, but that was actually for the year 2020. And so this is a significant problem. And of course, most of these people are concentrated in low and middle income countries. And yeah, who have also other important health risks and concerns to be worried about. This is a little bit of a dated map. We have more recent ones, but the coloring wasn't so well. So I really wanted to show you here to help you understand where is these big problems. And one continent in particular, sub-Saharan Africa, is probably the continent where the problem is really very large. And there's not a lot of progress, and we'll see that a bit later in terms of actually transitioning to cleaner fuels and clean household energy. We also, for example, in the Southeast Asia region is also a area where we've had a lot of issues, and we have, I think, India, for example, is at about 60% of the population has reliance on clean fuels and technologies. So you're talking a significant number of people in that 40%, for example, that are still relying on polluting fuels and technology. But you have other areas. China is another area where you have a lot of, particularly in the rural areas, where many people are still relying on these, in addition to other countries like Myanmar, Cambodia, etc. Now, in terms of Latin America, they've actually transitioned quite well. There's a few countries, for example, Haiti, Colombia, Peru, etc., that are still in this transition, but they've advanced much further. So what does it mean? So we got about 1/3 of the world's population is relying on us. And so what does that mean in terms of disease? And this is what's shocking. Leads to an annual average of about 3.2 million premature deaths each year are associated with exposure to household air pollution. And this is typically from diseases related, are non-communicable diseases, such as ischemic heart disease, stroke, chronic obstructive pulmonary disease, and lung cancers. And this, again, is because that fine particulate matter can cross over the interstitial barrier and impact your body systemically. So you have these pollutants circulating all around. It's also a very important risk factor for child pneumonia, or pneumonia in general, but in particular childhood pneumonia. And it was responsible for typically about half of the deaths of childhood pneumonia are from exposure to household air pollution. So it's a really important opportunity to protect the health and well-being of young children in particular. There's a lot of other emerging evidence because, a lot of our evidence we can actually gain from ambient air pollution. We can extrapolate to household air pollution because the fine particulate matter is consistent between them. And so much of this evidence is there, and we're seeing in both ambient air pollution or household air pollution and outdoor air pollution and household air pollution, a lot of emerging evidence linking exposure to adverse pregnancy outcomes, such as low birth weight and small for gestational age. We also see linkages with diabetes, nasopharyngeal and laryngeal cancers, cognitive development, and tuberculosis. So these are some of the ones we say emerging because the evidence currently, the epidemiology, either we don't have a lot of numbers of studies, or there's actually some mixed results in the case of tuberculosis. But we do hope that, and we rely on you researchers to continue doing this great work, because this is the only way we can actually make and quantify these. Is WHO will only quantify diseases for which we have strong epidemiological evidence, and we have a various rating and criteria for that. And now, so as you can see, these diseases are a lot, and they're very chronic in nature, and so you don't necessarily have, these populations aren't visiting the doctor on a regular basis. This is not something, they don't have routine checkups. So it's really an important opportunity to protect prevent disease early on for populations that don't have access to medical care very easily. Now, there's other impacts, specifically from household energy use and typically inefficient household energy use, and that's safety risks. Household air pollution, household energy use using unstable cook stoves and things is one of the largest sources of burns and scalds in low and middle income countries, particularly among children. In addition, kerosene, for example, which is also considered a polluting fuel, is actually often stored in like water bottles in the home. And so kids pick it up and they drink it, and they don't realize that that's actually a poison. And it's one of the largest sources of childhood poisonings in low and middle income countries as well. In addition, musculoskeletal injuries, these have not necessarily been quantified in terms of relative risk as of yet, but considering you're carrying these bundles of fuel on you for hours, and many times it's young children who are sent to do this, and they're carrying them long distances, this is going to impact the way the body is developed and the skeletal structure, etc. So this is an important thing that we have to consider, as well as musculoskeletal injuries. In addition, an important aspect from household energy use or inefficient household energy use is actually the time loss. And in many ways, this is what actually households see as the benefits of clean household energy is actually the time savings that one has to use. We have a WHO database that really looks at fuel wood collection based on the household surveys. And we can see on average, I would say it's between 2 to 4 hours per week children are spending each week going to collect wood and water, and which is typically often wood in this case. And this is a huge loss. These children could be going to school, or they could be having some kind of social life, development, interaction, etc. or it's also bared on the woman, right? So the woman is actually loses this time from income generation, again, socialization, et cetera. So this is an important aspect for mental health and well-being. So giving you the health impacts, which is pretty substantial if you ask me, and quite a shocker. But we also have environmental impacts from the household energy use. And this is an important aspect that really can raise this issue among a different crowd than the health crowd, right? And that's, for example, the outdoor air pollution is very much an environmental issue. And household air pollution itself is responsible for, in some countries, 25 to 50% of the outdoor air pollution is actually the household air pollution leaking outdoors. So this is a real critical issue to really tackle outdoor air pollution. You actually have to tackle household air pollution. For example, in China, they had their, the battle against pollution, I believe was what it was called. I can't remember the exact terminology. And in fact, they were aiming to focus on outdoor air pollution and tackle that. And how did they do that? They went and started putting natural gas in as heating systems to prevent the outdoor air pollution, which also prevented the indoor air pollution. So this was an important aspect that they weren't aiming to address household air pollution aspect, but by addressing that they were able to by addressing outdoor air pollution. In addition, there's a massive substantial climate impacts from household energy use or inefficient household energy use. And it's estimated most recently about over 50% or more of black carbon emissions globally is actually due to residential biomass use, this inefficient use of residential. So this is a huge aspect and opportunity for climate, as black carbon has about the climate forcing of about 1,500 times that of CO2 emissions, and they have act immediately. So we are actually, much of the warming we're experiencing today and we're seeing today is actually due to these short-lived climate pollutants like black carbon. So you can actually see an impact very quickly on the climate and the general environment if you were to actually change clean cooking and clean household energy, because you will actually see a reduction in black carbon quite quickly. In addition, household energy use, as I said, fuel wood is an important source. It leads to actual deforestation. I think it's about 30 to 40% of household fuel wood is actually sustainably harvested. So we have a massive amount of deforestation that's being led due to household energy use. And you can see maps, for example, of, Haiti, and you will see that the island on one side is blank, just wiped clean because they've basically harvested all the trees and there's nothing left. And then you go to the other side where Dominican Republic, you can see full breadth and beautiful trees because they protected it. So it's a really an important source. And as climate change pursues and goes further, the scarcity of fuel wood is also becoming an issue. So these households are actually even having to travel further and further to find fuel wood if that's what they rely on. So this is an important, again, aspect of really how we can improve our biodiversity, protect our earth, while as well improving the health and livelihoods of many people around the world. So now, to really make action happen, we got to have the dollar sign, right? The Ministry of Finance is one we go often in WHO and speak with various ministers of health, ministers of environment, ministers of energy, but it's the Ministry of Finance that you are going to have action happen. So we really needed to calculate and start to better quantify that actual economic burdens or economic costs of household energy use, accounting not only for the fuels being used, but what are those societal impacts such as time loss, climate aspects, health sector costs, etc. So this is summarizing something from a recent, I think this is actually the State of Access to Modern Energy Cooking Services report from the World Bank SMAP, which Max contributed to. And this is they quantified that's about $2 trillion per year due to the cost of relying on polluting fuels and technology in the home. That's a big number, and you could do a lot with $1 trillion. And what is that? How does that break down? About 1.4 is due to healthcare costs, because again, people get sick, they have to go, and often they end up going to emergency clinics because they're not regularly getting checkups and these things. And then you have about 0.8 trillion, or a little less than 1 trillion, from loss of productivity of women. Essentially, these women could be doing other things rather than spending hours tending the fire and preparing the stove or searching for fuel wood, processing the fuel wood, etc. And then you have the 0.2 trillion from environmental degradation. And so basically, they estimated in this report that, yeah, around $1,000 US is lost per person who is still relying on polluting fuels and technology each year. Those are big numbers. So why is it so hard? We all have it here. Why is it such a challenge? And this is, we're not sure. But if you look over time, we've been quite stagnant in general. And this is, this model's estimates back to 2000. And in some regions, we see great progress, such as those in the Southeast Asian region, Central and Eastern Asian regions. We actually see the decline. And it's been, as I said, the Latin American region has done pretty well and has been maintained pretty flat. But you see sub-Saharan Africa, the actual population relying on polluting fuel technology is going up. That's because the actual the transition to cleaner fuels and technology can't keep up with the population growth in Africa. So essentially, we're trying to get it out as fast as we can, but the scalability, it's not happening. There's not enough resources in these things happening. And this is a trend we see each and every year. So in addition, there's inequity, right? Even in the clean cooking transition. And this is the fact that you can see here in the 5 most populous low and middle income countries, that's where we've seen the greatest progress in terms of achieving clean cooking and transitioning, right? But then if you look at all the other countries, you basically flatlined. We've improved maybe 2%, 3% since 2010. So it's basically there. So it's an equity issue. So we need to be focusing on all those countries, even the smallest countries. We need to be addressing their populations and making sure that we can achieve clean cooking. And as mentioned on the current trajectory, the goal is to have universal access to clean cooking by 2030. But the way we're going now with the recent trends, we're going to get to maybe 3/4 of the population by 2030. So again, why is it so hard, right? That's because there's a lot of different barriers to actually the adoption of clean household energy. And I want to highlight the word adoption here because that's important for improving health. We run in terms of this kind of high level aspects. We say, oh, they main access, but it's to improve health, we really push the adoption because we need people using this over a long term. The chronic diseases happen because you're exposed every day. You're breathing this in and out. And we're talking 1,000 times the actual guideline levels of pollution in these homes. And breathing that in and out every day is not good. So having a clean stove and using it for 6 months and only part of the time, that's not going to fix the problem. We really want the households to integrate this into their natural practices. And this is just part of their living. So this is that adoption aspect. So there's kind of 3 categories of barriers to the adoption of clean household energy. Some are specifically social-cultural. Some are cultural. My mom's been cooking, my grandmother's been cooking, my great-grandmother's been cooking this way. Why should I be worried about this? Is it really that big of an important health risk for me? There's also this idea that, I prefer the food this way. It tastes better when it's cooked on open fire versus not. Noting there have been blind tests that show that people cannot actually taste the difference, whether their naan is cooked on an open fire or their naan is cooked on an LPG stove. So again, this is this perception. So, and then there's this idea of, good and bad experiences in the community. Oh, it's a social thing, and that this woman uses this stove, this is the better stove, and these kinds of things. So there's a lot of different aspects that one has to do in the socio-cultural. And this is where that's important, this whole stacking aspect, and that you really, to protect health, need to consider all the fuels and technologies used in the home. And so, for example, here, you may have one clean stove, but they're using other things. They have their open stove here in the back. Oh God, it's going on its own, sorry. And then we have the lighting, and then you may have a kerosene lamp next to an electric lamp, et cetera. So to protect health, we really need to push towards all the different fuels and technologies that are being used. We want clean stacking. So we call this kind of fuel stacking, fuel and technology stacking, where we're using multiple fuels and technology. I mean, I'm sure everyone here in this room uses a coffee machine, uses a stove, has an oven, these things. We all use different ones. Then there's no reason other people wouldn't want the same. Another big barrier in terms of transitioning to clean cooking and clean household energy is just this idea of the barriers of economics. the affordability is an important aspect, right? Households typically don't have the money to put forward, and many of these households are living on $2 a day or what have you. So investing in a clean stove and technology requires a lot of upfront investment. Over time, though, of course, the investment pays back, but you need to have that initial startup. In addition, the governments themselves, it requires a lot of infrastructure to put in place. And, there's some advantages now with decentralized renewable energy, providing some facility for more accessible cooking in remote areas that doesn't require as much infrastructure. Although for cooking in particular, because of the high energy demand, that's still slow to come about. So we really have to support, the governments really need money to really scale this up and roll this out. Now, if you actually looked at the number, the actually billions, I think it's 8 billions necessary each year. It's actually a small number compared to the amount of money that we spend on many other things, even electricity access. So, but it's difficult for people to get their head around, oh, clean cooking. Yeah, maybe that's something I should do, because we've been around, we've seen it for so long. It's kind of ingrained in us. Oh, it's fine. This is somebody else's issue. So, and I said, there's other factors, the barriers. LPG, liquefied petroleum gas, which is one of the most scalable, clean at point of use cooking fuels available. It's perceived as unsafe. And this is, again, this idea of risk perception. They have an explosion in a village, because occasionally there are. I believe there was one big one in Indonesia recently, explosion. So that basically sets the whole community off. But that's because it was right there in front of them. But they aren't able to conceptualize or picture that actually they have thousands of their people, their friends around them that are exposed to this each and every day and are getting sick, because it's not right in front of them. It's not an instant thing that happens. And so this is something that's difficult to do, is this perception. And again, this availability, sometimes the fuels and infrastructure is not available. So households don't want to change back and forth. Oh, I don't have that fuel available today, or this, the grid is out. I don't want to do this. So they end up just using the traditional practices over and over. Yeah. So I've kind of laid out the problem. I realize now I'm already going too late. I got so excited because I never get like 40 minutes to talk. I usually get like 5 minutes, but now I'm going too slow. Anyway, so what is it the health sector can do? Why are we here? Why is WHO there, right? We can do a lot. We can actually provide the health evidence to really look at different interventions and drive that in terms of other agendas. We're not going to get clean cooking very high on necessarily a Ministry of Health agenda without understanding all the other aspects of it. So we can really bring together and show, look, this intervention can help you reduce this diseases. And so we can provide that evidence. And if you roll out this intervention, you can save this many lives or avert this many disability adjusted life years, et cetera. We also, WHO, for example, develops a lot of normative guidance. We have normative guidance for vaccines, normative guidance for medicines, et cetera. We have normative guidance, as mentioned earlier, on actual household fuel combustion and on air quality. What are the pollutant levels that are safe for health? So we provide that. This requires systematic reviews of the evidence, et cetera. We can also do health impact assessment to help countries, cities understand what the different intervention options are and how they impact health. And then we can really use the convening power. I think that's also an important aspect. People will come to the table. You can have the Ministry of Energy and the Ministry of Environment who have been working completely parallel processes, but actually somewhat diverging, but they won't talk to each other. But if you bring the health in there, nobody's going to argue, I don't want to protect health. No matter what ministry you're in, they're always going to say, yeah, I want to help health. And that's the way we can really bring people together. So, as WHO, we actually have a World Health Assembly, which is basically every year we have our bosses are the ministers of health. And so we actually every year, the ministers of health will come together at the World Health Assembly and they pass resolutions. Now, these are not legally binding resolutions, but they actually set forth and put a mandate on ministers of health to do something about it, as well as the Secretariat for WHO. So in 2015, the first ever World Health Assembly resolution was passed on air pollution, which specifically every minister of health, it was passed unanimously, which basically outlined and put every minister of health committed to implementing WHO guidelines, which include those for household fuel combustion, and also really put it on the onus of the health sector to also lead by example. So we now have this mandate, and so we actually have a roadmap that we've worked. So we can now go to countries and say, well, your Minister of Health agreed to this. Where are you on this? Where are you? Let's bring you on board. Now, to develop our guidelines, we have to look at the environmental pathway. And so we actually, household energy is a bit of a tricky thing because you can't just, it's not like a medicine. It's not a drug. You can't do some quick randomized controlled trial and say, oh yeah, this is perfect. Instead, we need to really look at the environmental pathway, and to really provide guidance to countries, we need to find out where is it that we can actually have an impact. So we had to look at, at various aspects, from the source of the emissions, the concentrations, going to exposures where we really want to do. And of course, dose makes the poison, but we have to stop at the actual exposure. So we actually use this pathway to help divide our actual guidelines. So these guidelines specifically are out there to achieve WHO more broad air quality guidelines. The air quality guidelines of WHO are actually meant for all environments in the globe, I guess, except those of occupational settings. So it's really setting those targets for various pollutants in the environment. And so we took those specific guidelines for pollutants and we translated those into technical recommendations where you could actually, for the stove and fuel technologies, those emission rates needed, what are the fuels and technology that are going to meet those air quality standards, and what is the policies to do that? And we developed these household fuel combustion guidelines. So as I mentioned, they provide specifically emission rate targets for fine particulate matter and carbon monoxide to determine what are clean fuels and technology for health. We as WHO are actually fuel and technology agnostic. We just want fuels and technologies to actually achieve the emission rates put forward in these guidelines. It also highlights these guidelines also provide guidance on actually policy and transition, because transitioning to clean cooking is not like flipping a switch. It's going to take time and you're going to have various solutions. But in that transition, you need to prioritize those with actually the most health benefits. And that's important to look at the various technologies. And then based on this, we also have specific guidelines against avoiding kerosene and just do not use unprocessed coal. And then this idea of really linking climate synergies and health is important to actually push policy. And that's a good practice recommendation. Now, I just kind of jumped in. So these guidelines, they take about 5 years to produce. And it basically, we gather all the top scientists in the world and we review this, and we perform a number of systematic reviews and meta-analysis that actually inform the development of these guidelines. So they're very much articulated. I made the mistake of actually agreeing to serve as rapporteur when we were actually constructing the text of these guidelines, and it was a nightmare because one word is a huge issue, right? So these are very, very important, and they take a long time, but they're very rigorously evidence-based. So we need all the research you guys are doing, because we do use them at WHO to translate that for policy recommendations. Now, we had these guidelines and they came out, they're the first ever ones on household fuel combustion. There were lots of improved cook stoves that were saying, oh yeah, we're seeing thousands of lives, which we knew was not the case. So these guidelines actually said what is actually helping lives and what isn't. And then we're like, what is the opportunity to really roll these out? And this happened to happen. These came out just right before the Sustainable Development Goals were put into place. Do you guys know what the Sustainable Development Goals are? Okay, I won't go into them. So I was really excited because you know what, the current SDG for clean cooking was initially marked as population relying on non-solid fuels. That was going to be the way that they were going to mark as the transition to clean cooking. And I was like, because we can't necessarily, we could get an amazing biomass stove that burns biomass cleanly. And, there are some liquid non-solid fuels that are not good for you. So we really saw this as an opportunity to integrate health into the monitoring of energy and really putting forward an actual clean definition for health in terms of the Sustainable Development Goals. And so here we actually use this, and that's how we use it each year. We report every year in cooperation with the other custodial agencies for SDG 7. So WHO is the custodial agency for clean cooking, but we work with the World Bank on electricity access. We work with the IRENA and the IEA, the International Energy Agency, as well as the UN Statistics Division to monitor. And each year we produce new estimates for what's clean and polluting fuels and technology and access. So what we define as WHO for clean for this act are those people that meet the WHO guidelines clean for health. So either the guideline value or the interim target, because interim targets we have, You can't just switch, countries need steps to get there. So we actually achieve anyone that can read interim target 4 or the guideline value is clean. And then acknowledging the transition takes time, we're also quantifying now those transitionals that don't necessarily meet the guidelines level, but they provide some sort of statistically significant health benefit. And then we have the polluting. And now currently we just do cooking because the data is not available for heating and lighting, but we now have databases that we have collected data on heating and lighting. And so we hope to provide these more complementary statistics in the future. And here's just a quick thing. And I put transitional here in the middle because the biomass fuels, depending upon the stove they're paired with, could go either way. And so again, we saw this great opportunity to integrate health into SDG 7. And then we also are the custodial agency for SDG 11.6.2, which is ambient air quality in cities, or now we actually do ambient air quality globally because of our model can allow that. And so we actually wanted to take that we use both those indicators to actually calculate the mortality rate from air pollution under SDG 3. So we brought SDG 7, 11, and 3 to pull people together to really work on clean cooking and clean energy overall to improve ambient air quality and also to improve health. And so, yes, our unit is the custodial agency for each of these. So we take the mortality from household air pollution and we combine that with ambient air pollution to get this overall mortality rate from air pollution in general, the joint effects of household air pollution and ambient air pollution. And as you can see here, that beautiful clean in that definition, that is defined by WHO guidelines. And this is a huge success. I was very excited that this was the way it's articulated and that we actually have a clear definition of what clean is instead of improved or what have you. And this again has been useful to really integrate various statistics as well. As mentioned before, the global strategy for women's, children's, and adolescent health now includes clean cooking. We have the ISO, who is linked, the ISO standards have been developed in collaboration with WHO guidelines and various global tracking framework, et cetera. We're really now creating a very harmonized definition of what clean cooking is. And it's science-based, so that's very nice. So in some of the high important issues in terms of policy, in terms of time, I won't jump into those, except I want to point out the encourage multisectoral collaboration. The health sector is not going to fix the clean cooking problem. The environment sector is not going to do it alone. The energy sector, they do a lot of it, but they need guidance. They need to know what are clean. How can they make sure that they're protecting health? How can they make sure that their stoves and technology are being used and adopted? How can we as the health sector use our entry point in the home to convince users that this is important to protect their health? So accordingly, we have developed WHO, the Clean Household Energy Solutions Toolkit. It's been developed. We basically went after the launch of the guidelines and we went to every region of the world and consulted with ministers of health, energy and environment and other stakeholders, social development, gender, et cetera. What are the tools that you need and resources, information resources you need to implement these guidelines? Because they're hard. It's not easy to get to them. And, countries, if it was easy, they would have done it already. So we went in and we basically came up with 6 modules that they need. And each one of these modules actually provides a number of tools and resources like interactive web emissions models. We have a cost benefit tool, interactive cost benefit tool. We have standardized questions, et cetera. And actually you can walk through this entire process to develop a policy or adapt a policy or program for household energy to achieve clean. And like I said, we just piloted last May, our first ever. We actually have a guide that walks you through all the different steps. We piloted this in Rwanda and we're currently continuing to do so. And we're working with MEX in fact to pilot some of the tools and aspects here. And we hope to maybe work with them to pilot the whole process through one of the countries that they're working in. And it's very much how you identify policy, both technological and policy interventions, compare the two and the risk and benefit, and how you implement, monitor, and how do you use the health sector to your advantage. So in light of time, I won't go through these very quickly. I'll go through these more tomorrow. We have a module on stakeholder mapping, actually looking at the technological and policy interventions. This is the interactive tool. We have the guidance on standards and testing. So this is very important. We all look at our little energy efficiency label. This is an important way to communicate to your consumer. and what are those needs? And that's also the standardization for when things are imported into a country. Are they okay? Should they, do they meet standards, et cetera? And then we have one that's specifically on monitoring and evaluation. We need to know what the situation is to begin with and to monitor the impacts of whatever interventions put forward in a harmonized way. Also training our health sector to be our champions. Many actually, you'd be very surprised, most medical school curriculums do not even include air pollution at all. So we are really working at WHO, and this is one of our big projects now. We've just finished 12 modules that actually designed to train health sectors, so clinicians, nurses, midwives, and now we're working, for example, to develop and adapt tools for community health workers, as they're often the interface in many of these homes, to really be able to speak and prescribe clean cooking or clean household energy to protect health. And this is the training module that we hope will roll out, and countries are super excited about this. And then we have actually the behavior change is a massive important aspect of household energy and the transition. So we actually have a specific module on communications and the awareness raising. And this needs to be at the community level, the technical level, but also the political level to really have the impact that we want. So we have a whole set of community tools and awareness raising tools available with the Breathe Life campaign, which aligns well with the Breathe theme, which we're actually hoping to have we're working probably with the UNDESA and some other partners this year to have a whole clean cooking campaign under that Breathe Life umbrella. And so, in light of time, because I've already gone over my time, I'm sorry. I'll quickly go into how is it that we can use the health arc to convene different stakeholders. As I said, the health sector cannot do this alone. We can't all work in our silos. We really need to work together, and with such limited resources, we need to synergize efforts and tackle this in a very cohesive way. So as I mentioned, we have this big Breathe Life campaign, which is really trying to get countries and cities and things involved about clean air and advocating for it. But one of the big things that I'm very happy, and this is how I came around with the next, is the Health and Energy Platform of Action. This is the Health and Energy Platform of Action is a group of constituency of stakeholders. It was convened by WHO, the World Health Organization, the World Bank, the UNDESA, the UN's demographic, oh gosh, I can't remember what the acronym is, I'm sorry. UNDESA, as well as UNDP, the United Nations Development Program. And now it invites a whole bunch of different organizations, academia, as well as country representatives to come, and they work. And it really aims to achieve clean cooking by 2030 as well as healthcare facility electrification. So it's bringing the health and energy actors working together in a harmonious way. Because often they're working in silos or they're working in parallel. And so this is a way that we could really maximize, because countries need support. And this allows us to connect them to the right people and work together in an effective way. So the HEPA objective overall is to really ensure that health is achieved, public health is protected through clean and sustainable energy. So it was this idea of mobilizing political commitments, promoting this kind of country roadmap. So the idea is to bring various partners together. We know, for example, that's MEX. We're working with, they helped us plan, run the Household Energy Assessment Rapid Tool, the HEART report in Nepal. So this is a stakeholder mapping and baseline assessment. So we work with them and some of the work that researchers they have going on there. Also, in terms of the BARHAP tool, for example, they've applied that's their benefits actions to reduce household air pollution economic tool. So we've actually had a lot of technical cooperation, and they've been working with countries to apply that tool as well. So this is this idea of implementation roadmaps and really working with countries on the ground to use and apply to adjust their policies, address their programs in a harmonious way. It's also this idea of demonstrating leadership. There's not a lot of sectors working together the way that we are. I mean, honestly, it was a hard pitch, like, yeah, the health and energy sector can work together, even internally at WHO, but we had to really articulate how is it that we can work together and that there is advantages, and it really was, and it is already proven successful. And then we had the advocacy and outreach, and then this interdisciplinary approach, which is the kind of key HEPA objectives. And here are some of the HEPA members. As you can see, the MEX is on there, but we have other institutions involved, and there's actually, the list is a bit longer now. We just haven't updated the HEPA members slides. as we had several join in about September, like Power Africa. Oh, Power Africa is there, but there are a few others. And so in addition, so this is specifically meant to work, HEPA itself, Health and Energy Platform of Action is meant to work at both this technical level, the community level for the outreach aspect, but also the political level. Because this is very much as identified as a need, is that basically policymakers, heads of states, they don't even see it as an issue. And to really elevate clean cooking and to advance it, we really need to pull together high level actors. So our DG of WHO invited many ministers of energy, ministers of health, as well as heads of organizations, heads of states. For example, we have the Vice President of Spain serving on the committee, the coalition now, to really come and join forces to advocate for advancing this to protect public health. So he invited each of them, and this group meets about once a year. And we have various videos, high-level advocacy videos where they are speaking on these things, and we have them tweeting in aspects. And this will go forward even more so in the next year and a half, as we have a run up to a conference where we're really going to have very kind of regional tweets and these things and taking advantage of the social media and their high political level to advocate for clean energy. And they passed a strategic roadmap this past summer where it outlines specific strategic priorities for policymakers and to advance clean cooking and health. So that's the run of the show. I'm a little bit late and I was a very breadth of things, so I'm happy to answer questions as needed.